I'm Marcy Cody. I'm a registered nurse, and I have been helping people pivot when they get a horrible diagnosis. My husband was actually diagnosed with prostate cancer the year we were married. That was 1999. It's been 23 years now, and he's been stage 4 for, I want to say, close to 10 years. And stage 4 basically means that the disease has metastasized to the bone. Thing about it is, he has no pain, he has no symptoms from that, bone thing. There are symptoms that come along with the treatment for prostate cancer, but all those are manageable, and he's doing great. If you ask him how he's doing, he'll tell you, I'm doing great for the rest of my life. He's 79 years old. You would never know to look at him. He's still working. In fact, he's out working right now. But anyway, yeah, he has a tree and stump removal business. So if you're in the Chicago area, you need a tree or stump removed, you need to give him a call, okay? Yeah, just message me. So what I'm going to be doing, I'm going to be looking at the comments, and if someone has a specific question, I'll be answering the questions. If you're watching a replay, then add your comment, and I'll be checking it maybe once or twice a day, and I will reply to the comments that you have left. My main mission in life, I believe, is to teach people about being healthy, about what they can do, things they can do. Because doctors are not going to tell you things you can do to cure yourself. I'm just saying, because they are medical doctors. The MD behind their name means medical doctor. So what that means is if you go see a medical doctor, they will write you a prescription because that's what they do. You can't fault them for it. They're practicing medicine, and they have a license to practice medicine. Okay? So that's what they do. So that's fine, because medicine has its, place. There are things that you absolutely need medicine for. But sometimes if something is diagnosed early enough, there are things you can do to prevent it or to keep it from going to a point where you actually need medicine. But doctors are not really trained in that. They're more trained to just give medicine. So if you have, for instance, I'm going to say, and disclaimer, my view, these are my views. They have not been evaluated by the Food and Drug Administration, and they're not intended to treat, cure, or prevent any disease. Please consult your healthcare provider before following any medical advice that you get from Mark. That, for instance, you had a diagnosis of what they call borderline diabetes. Now they call it pre-diabetes, and now they have a test they can take that's called the hemoglobin A1C, which shows how your blood sugar has been for the last 3 months. So it's not like you can not eat anything sweet for a couple days and then have a good blood sugar reading anymore. Okay, so this goes back 3 months. So if your hemoglobin A1C was high, then the doctor would say, oh, you need to get on medicine. He wouldn't tell you that maybe if you went home and did some exercises and drank more water and talked to a dietitian and changed some of your eating habits and come back in 3 months and see what your hemoglobin A1C is, and then we'll decide if we should give you medicine. They will just give you the medicine, okay? But that's what they do, all right? So if you have any questions for me regarding your health or regarding how to become a best-selling author, feel free to type them in right here.